And just after 11 o'clock in the morning, Dr. Payne's show. Dr. Lou is here after a busy week, my friend. Your phone calls, of course, will be taking those throughout the next 2 hours. 416-870-6400, star 640 on sale. Week that was, things that have happened. What's going on? We got a guest today, by the way.
We do have a guest, cool. Yes. We have my mentor, Dr. David Greif, the guy that taught me everything, or at least helped me to go on to learn as much as I have. He was... when I was a student at U of T, I was shadowing with Dr. Greif, and it was there that I decided I wanted to get into healthcare and chiropractic. And so, we have Dr. David Greif here today. Excellent. He's a chiropractor. He also practices acupuncture and traditional Chinese medicine that he studied in Sri Lanka back in the 90s. Right, Dr. Greif?
That's right. It's a pleasure to be here. Thank you.
No problem.
Can I just mention on the side that I recognized his name as soon as we walked in? That is the family name of Greif being Greif Bagels right in the city. Just an absolute institution in this town.
That's right.
I'm hungry already.
Yeah,
there you go.
Yeah.
What I'll mention there is we have a lot of people in the family who are doctors. We have people who are heads of departments in various hospitals with the name Greif. But if you mention the name, people only think about bagels.
There you go. Yeah.
See, as soon as you walked in, right?
Yeah, for sure.
So what have we got going on?
Well, I wanted, Dr. Greif has a lot of experience. He's been practicing since 92, 93?
92, yeah.
92. And he's gone through a ton of interesting cases. Some of the early interesting cases that I saw were with Dr. Greif, some neurological stuff like the pronator drift patient, which, again, is a neurological sign that we can pick up with our testing to determine that there's maybe something going on in the spinal cord or brain, some type of problem. So, Dr. Greif, if you have any interesting cases that you can think of from over the years, I'm sure our listeners would love to hear them.
There are so many people I could talk about, but most recently, someone came to me who had been in quite a serious car accident, and unfortunately, she ran out of coverage through the insurance, and she was still very motivated to heal from her injuries, still very, very impaired. And, we can't always do something for someone else, and my impression was immediately that I had to help her find a way to get herself back. Mm-hmm. And so I said that I probably wouldn't be doing a lot of hands-on work, but what I would be doing would be helping her to learn to move again.
Right.
And because I've been practicing and studying and teaching Tai Chi since 1991, I thought that would be a great way to spend time with her. Rather than using passive care and doing something for her, I am directing her through a process of learning to move gracefully, carefully, mindfully. All the new buzzwords that we have are ancient concepts on health and movement.
Right.
And it's amazing. I mean, she the very first time that we did this, she walked in very hunched, very impaired, very crippled. And she walked out, and you would swear it was a different person entirely.
Right.
It was a really, for me, even knowing what the power of this kind of movement can do, it was absolutely a miraculous effect. And I think that's probably one thing that I would really like to impart, is that people can really help themselves if they understand how to do it, if they understand how much power they have for their own healing, that it can be used.
Yeah, for sure. And that's a concept.
And you've said that so many times on the show. It's, I can get you so far, but you have to be part of this.
The active component, and that's what Dr. Greif's talking about here. There's the passive stuff that the professionals can do with you, and you do need professionals to guide you even through the active component. But, people, I've always told every patient that I have, you can come see me for an hour, even 2 hours every single day, but you would still have 23, 22 hours in the day that you're going to be with your body. And if you don't do the right things, then it really doesn't matter what we can do for an hour or 2 hours in a day. You have to learn, you have to be educated so that you understand what's potentially harmful, what's good for you. And a lot of times those things, although they may make sense, oftentimes don't. There's some things, we often talk about a concept of hurt versus harm. And so sometimes people are afraid to do things that hurt them, but they're not necessarily harmful. And vice versa, they'll do things that don't hurt them, but are harmful. And I guess a good example of that is people who have things like disc herniations, and they'll want to sit for a lot of the day just because of the uncomfortable nature. But that sitting component can actually be quite harmful versus when you try to get them to do exercises and they go through a little bit of a hurt component. Well, that hurt has to happen. And most people that have worked out understand that beneficial type of hurt that's actually good for our bodies, that gets us stronger. So the active component is so big. And I know Dr. Greif has always been an advocate of active care for patients. And it's so extremely important that people have to be willing to do it for themselves. And I think I've even mentioned that one of my first clinicians when I was about to graduate, one of the first things he said to us was that you can only help somebody as much as they want to help themselves. And that's kind of the role that we have to fill. We do our best to try to help everybody, but some people are just their own worst enemies. And our job is really to try to help them get over that hurdle as well and maybe make them realize that.
I would never realize that Tai Chi would be a part of that, part of that plan as well. It's the first time I've heard of it.
Right. It's growing in research evidence. And, I was on it a long time ago.
Big time.
My first email address had the word Tai Chiropractor in it.
That's got a good ring to it, right? Yeah. Let's take a short break, guys. Our first one of the morning here. We're here for 2 hours today. Your phone calls, of course, 416-870-6400, star 640 on cell. Dr. Payne. And the Dr. Payne Show is right on right now. Talk Radio, AM 640. 2 hours today, 11:13, Dr. Payne Show, 416-870-6400, star 640 on cell. You got Payne's concerns, health concerns. Bring them on. We'd love to talk to you. Both doctors here. Dr. Greif is a special guest with Luigi as well today. Got Brad on the line. Hey, Brad, what is happening? Weird pain, I see.
How's it going? I'm a young guy. I'm like 22. I don't smoke or anything.
Okay.
I mean, sometimes, it's on and off. When I lay down for a little bit, I get a pain. I was always in the exact same spot. The pain in my chest, about 3 inches below my collarbone. And, I sit up for a couple minutes, it's gone. And then I might lay back down. 20 minutes later, the pain will show back up again.
Okay. When did this start, Brad?
Yeah, 2 years ago, maybe. I don't know. I just never get around to talking to someone about it.
And so you've never had this checked out whatsoever?
I went in and talked to somebody about it, and they said they didn't really know what it was. They didn't.
That's good advice.
Perfect.
I'm not
Off
really
you
sure.
go.
Yeah. Hi, this hurts. I'm not sure what it is. You can leave now.
Have a nice day.
What side is it on, Brad?
Left-hand side, about 2 inches below the center of my chest and about 3 inches down from the top of my collarbone.
Okay. So anytime we're talking about left-sided stuff, obviously one of the things that you always want to consider is heart stuff, which, you're young, so it's not as likely, but that doesn't mean that it's impossible. And, in ruling out cardiovascular stuff where you're looking at the heart and the lung on that side, and if you're able to rule out those things, oftentimes what's left behind is musculoskeletal issues and sometimes, things like a rib issue. And I actually myself had a rib issue this week that I got Dr. Greif to treat from the wedding that I was at last week. So
that was the buffet or like your internal ribs?
Yeah, no.
Okay, just making sure.
Yeah. It felt like a rib was out. So yeah, I had some treatment. But yeah, oftentimes those types of things. Dr. Greif, do you have any insight on this?
So what we know is mechanical pain can show up from postural stress and so on. So it sounds like when you're lying down, maybe there's a lack of compliance in your upper part of your back. The thoracic spine might be a little bit stiff. The ribs where they attach around to the front could be getting a little bit compressed. And sometimes this is a very simple thing to fix. I'd ask you, have you tried doing any stretching for your upper body?
I used to have massage therapy for my shoulders, and they kind of had stretching that they provided through that I stretch out when I feel the pain.
Yeah.
And yeah, it helps relieve when I sit up. And I don't know, it's just weird that it never affects me during my day-to-day life.
Right.
It's only when I lay down. Sometimes I wake up in the middle of the night with the pain. I'll sit up for a few minutes and then gone, lay back down and sleep through the rest of the night.
Okay. Any difficulty with taking deep breaths in, Brad?
Sometimes when I have the pain, but after it clears up, everything is clear.
Mm-hmm.
Yeah. You could also get referred pain from a place in your neck, somewhere in the middle to the lower part of your neck, that can actually refer to the chest.
Right.
It has a fancy name. They call it cervicogenic pseudoangina.
Yeah.
It just means chest pain that comes from the neck.
Yeah.
It's a lot easier.
Everything's got to have a medical term to it, John.
Yeah. So having someone who specializes in physical rehabilitation take a good look at the function of your joints, of your neck and your upper back and your shoulders, they could probably identify an area that is responsible for that.
So yeah, Brad, for sure. This is something that we would be well equipped at our clinic to deal with. If you're interested, give us a call, free consultation with me. We can go through a little, more in-depth type of an assessment to try to rule out some other things. And then if it is, again, musculoskeletal, which is, it is likely sounding that way and also based on your age. Obviously, we have to do our due diligence to make sure that that's the case. But definitely something that you can get rid of, and you don't have to be living with this. And this doesn't have to be long-term either. A lot of this type of stuff, too, is getting some passive intervention to remove the irritation. But then a lot of it, the way we started the show, was talking about the active things that you can do. And so, some strengthening, some stretching, depending on the areas that we find to be tight or too loose, respectively, we'll make recommendations. Okay, Brad?
All right.
Okay.
We'll get to Steve quickly here. Steve, we got about a minute before we go. What's your concern? Hey, Steve.
Oh, hi. How you doing?
Good. What's up with you, Steve?
640, my favorite station.
Nice.
I don't turn a TV on anymore because what's happening is my left ear keeps ringing. I wonder if it's from thinking too much. I lost my spleen in '89 in a car accident. And ever since, my health has been downhill. I haven't been able to work. So I basically sit in my room all day and stare at the walls, and I'm like going crazy. Like I'm not, I'm just thinking too much. And I just heard you talking about Tai Chi, and I'm really interested in that kind of it's almost like meditation. Tai Chi means projecting energy, is it? And I think I got too much energy stored in me that I don't know how to let it out.
Yeah. There's a lot to talk about here, but basically getting moving would be a great thing for you.
You go for walks a lot.
You do walk a lot?
Yeah.
Oh, that's terrific. Yeah, getting outside, getting a little sunshine on your skin, getting some vitamin D. There's so many things that you can talk about as far as improving your health. But certainly sitting in your room is unlikely to be
one of
the path forward.
Right.
Yeah, for sure. And we were just talking about this on our way here, but I think we have to take a break, right, John?
No.
Well, and then we'll touch on this. But the mind, and we've talked about this a lot, how important the mind is in pain management.
And more of your phone calls, 416-870-6400, star 640 on cell. It's a Dr. Payne Show, Talk Radio, AM 640. 11:23, hour 1 here, the Dr. Payne Show. Dr. David Greif is here, our guest along with you. Dr. Lou, the phone calls always. Tony, how are you, pal? You're on.
Fine, thank you.
What's going on with you?
My wife has a sciatic nerve that, man, I tell you, some days it's a pain in her behind, man.
Literally,
right?
I'm telling you, what kind of exercise or what can she do?
Right. So one of the things when we talk about like sciatica, which is often a term that gets thrown around, that tells us that the sciatic nerve is irritated. And then the next thing that we have to try to figure out is, why is the sciatic nerve irritated? Could it be a muscle causing pressure on the nerve? Could it be something like a disc herniation? Could it be something more serious? So those are the types of things that you have to figure out. That's just what we would call a clinical sign, that knowing that somebody has what we call radicular features in that nerve. And so what we have to figure out, again, Tony, is trying to figure out what's the cause of that. And then in finding out the cause, I often say once you know the diagnosis, that's when you can make treatment recommendations. So there'd be no justice done to just saying, here's kind of an exercise that you can do for a sciatic nerve irritation, because it would be different from individual to individual, depending on what the potential cause of that irritation is. Dr. Greif, do you want to add anything to that?
A lot of times things are lumped together as far as sciatica.
Yeah.
So anything from a strain to a disc herniation, or potentially something more serious like a tumor, could cause pain like that. But the less serious things, including a disc herniation, are generally self-limited and will have a period of a natural history where there'll be pain and then diminishing pain and then gradually a resolution. Yeah. It really, if you could tell me how long she's had it, I'd have an idea, maybe a little bit more. But
you know what? It's about 2 years ago. She had a car accident.
Yeah.
she had a car accident, and then she slipped on the ice once I'm trying to catch her balance, broke her legs, and it's like it runs from her below her back all the way down to her legs.
Mm-hmm.
Yeah, I would say if she hasn't had a thorough investigation with imaging and clinical examination, then that should be done to identify what the problem is.
Yeah, for sure.
She's been going to get what do you call nerve blocks or something like that,
Mm-hmm.
so that you alleviate the pain.
Okay.
I don't know, but she ever so often she has to go in to get a nerve block, and I don't know.
Yeah. So, yeah, and when you're getting a nerve block, that kind of indicates that the nerve is irritated. Do you know where the nerve block is happening? Likely right at the spine level?
Yes,
Yeah.
exactly.
Yeah, so, again, that's kind of the mystery is trying to figure out exactly what the source of pain is. And then one of the things that we've often talked about is that you can have something called neuropathic pain, where the pain signals can be learned and they kind of exist in the absence of a true physical problem, and that's a whole other area of treatment just on its own with trying to treat the mind as well. So yeah, it's very complicated, Tony, in terms of just a simple, quick solution. And obviously, I think everyone can appreciate, I can't just give you one quick thing and that's going to be the be all end all. But if your wife's interested, we'd be more than happy to take a look at her case and have a second opinion on what's going on and maybe some recommendations there.
Okay, can I get a number?
Yeah, 1-855-55 DRLOU.
DRLOU.
Yeah, 1-855-55 Dr. Lou is basically what it is. Mitch, how are you?
Not too bad.
What's happening with you?
I tend to get a lot of indigestion, a lot of kind of heartburn, and I know it runs in my family in terms of kind of temperamental stomachs, but I'm only 24. I've had it for quite a bit, but I get like a lot of indigestion, and I take maybe one pack of Tums a day or a month, like one of those large packs of Tums, the extra strength pills. And I went to my family physician, and he just he didn't make it seem like it was that big of a deal, but the amount of Tums that I'm eating is record holding.
What's your diet like, Mitch?
I do eat fairly healthy, like a balance of fruits and vegetables in the mornings and throughout the day. But, at times I'll splurge and I'll get something that isn't as healthy. Mm-hmm. I do find tomato sauces really terrible. Like they seem to really stir it up.
Yeah, potentially the acidity. Yeah.
And I also find that not greasy food like French fries and things like that, but fatty, greasy foods like ground beef seems to really do it.
Yeah.
Like tacos, things like that really can mess it up.
Okay, Mitch, this is Dr. Greif. I'll just give you a quick rundown on the dietary therapy according to Chinese medicine, because it really is the basis for all of the Chinese medical treatment, and it really applies here. So the stomach is considered to be like a soup pot, and you have to cook up the food and then vaporize it into energy. That's how they view the digestive system. And if you're putting in foods that are what they call dampening, so that's foods that are sweet and sour, like tomatoes, or greasy foods, or really cold foods. So if you're eating yogurt out of the fridge, all those things are dampening foods, and it's very hard to cook that stuff up for digestion. So a complete food diary for a week would be useful. Bring it to someone who knows what they're doing, and get your diet reshaped for a while. Feed yourself. I like to tell people, feed yourself like you're an infant just starting to introduce solid foods. Right. If you do that again, start from the beginning, you'll do much better.
Good.
Your phone call is 416-870-6400, star 640 on cell. Dr. Greif is here, and of course, Dr. Lou here until 1 o'clock to take your phone calls and your health concerns. Bring it on the Dr. Payne Show, Talk Radio, AM 640. 11:32, hour one of the Dr. Payne Show. If you haven't noticed, we're going right to 1 o'clock. This extra hour, we do this once in a while, and we love it. Got Dr. David Greif in here as well with you, Dr. Lou. So we're going to talk mindful stuff.
Yeah, for sure. And as we were driving here, Dr. Greif and I were discussing, and we've discussed this at length on the show for sure, the role that the mind plays in pain management and how very important it is. But Dr. Greif was talking about a lot of interesting things that he's looked into, which I was hoping you could share with the listeners.
I'd love to. So there's a concept known as pain centralization. And that means there's two different versions of that, but the one that I'm referring to is when pain takes up residence in the brain. And so you may have had an injury at one point, but that injury, the tissues may have healed, but the pain hasn't gone away.
Right.
And the proof of this, if anybody doubts that, is phantom pain, phantom limb pain. You can have pain in a foot that doesn't exist. A foot could have been amputated, and you could still feel a real pain in that foot because that piece of your body is still represented in your brain. That part didn't go away.
Yeah.
So it's very possible. And what some neurologists will say is that all pain, in a way, is phantom pain because it's all a representation in the brain.
Yep.
We do have, as I'm sure Dr. Lou has mentioned before, nociceptive pain. That's where you touch the stove and you feel pain right away.
Right.
That's a protective mechanism, and not having that, in fact, is an impairment.
Yeah.
In leprosy, people have a loss of that pain sensation, and part of the reason that people will lose tips of fingers and so on in leprosy is a loss of nerve function and also a loss of pain sensation. So there's no protective mechanism. Pain can be protective. It can also turn back on the host.
Yeah.
So when pain takes up residence in the brain, it actually invades an area called the anterior cingulate cortex. It's a part in the cerebral cortex that sits right next to an area that's responsible for your imagination, visualization. And if you're in pain for a long time, your ability to be creative will diminish gradually as pain takes over that area of your brain.
Yeah.
The active part, the way to get back at it, is to use your imagination. And one simple way to do that is by breathing into the pain, by imagining that you're filling a balloon where the pain is. And I like to tell people, fill a red balloon, a bright red balloon. And when you breathe out that redness. And when you breathe in, it's now a light red balloon, and breathe out that. And then it becomes a pink balloon, and breathe out the pink. And then it becomes a white balloon, and breathe out. And use visualization, imagination, imagery. And for most people, they have a very powerful ability to eliminate pain, at least temporarily. Mm-hmm. The key is, though, if you can eliminate it temporarily, it means it can go away.
Right.
I've had chronic pain in the neck after a bike accident, and it went on for quite a while. And I developed my own techniques that have now been proven in other research studies to be a valid method.
Right.
I came to it on my own, and I know that it works. Mm-hmm. I know that using your imagination and using your willpower to focus on relieving your pain and not causing yourself pain. That's another big part of it. When people have chronic pain, they often will check on it like a friend. Yeah. Are you still there? Yeah. Are you still there?
Oh, yeah,
Are you still
right.
there?
Yeah.
And training yourself not to look in for the pain, not to look into it, not to try to find it, can really help.
Well, it's not uncommon, and I think you'd agree with this, Dr. Greif, that I've had a lot of patients who will talk to me about some type of pain that they have. And one of the questions that we like to ask are relieving factors. What are things that make it better? And it's not uncommon to hear, if I'm doing something and I'm not thinking about it, it seems to be fine. And that whole concept of distraction, like not checking in on it, like it's your little brother or something, really does help. And it is a very important technique. And what you touched on with the ability to lose imagination, another thing that's not uncommon is I've met many people who have fallen into chronic pain, and you're seeing them when they're kind of at the bottom of everything. Their life has spiraled downwards. And I've met people who, prior to being in whatever accident that led to chronic pain, were high-level executives or a high-level professional, really great lives. And everything after that just kind of went downhill. And the reason is like you mentioned, that ability to lose the imagination. Their life gets focused in on just that pain, and that's all that they're thinking about. The other thing that we sometimes have to consider is and I think you agree with this, Dr. Greif, some people like having a crutch in their lives, something that they can blame everything on, saying, oh, well, I'm in pain, so I can't do that. And there's plenty of people that I know that I've seen, and I know that you've seen, that actually want to be in pain. They almost don't want to get better because it's that secondary gain component. They can be off of work or get some type of compensation from some type of an insurance, et cetera, et cetera.
It does. It is true, and it's very sad to me that is the case because you don't get a day back that you waste.
That's right.
And so much time is wasted on focusing on your misery. And you know what? Even if things are great, you can find something to complain about.
Yep.
But why?
Exactly.
A lot of times, looking too deeply at yourself can be a source of problem, and getting out and doing something for someone else can help people who are in pain.
So volunteering, things like that, right? Yeah,
yes.
And that's a big thing for sure. I know a family member of mine that was going through some chronic issues, started volunteering, doing things like that, and she found that she was getting better, just like you said, by being out there doing stuff for others and trying to change. I also think that serves as distraction to a way, right?
You don't dwell on it, right?
You're not dwelling
on
on it, but yeah, the mind is so very powerful, and it's often a piece of the puzzle in pain management that's forgotten. Is we're always focusing on, what type of chemical intervention can we have, what type of physical intervention can we have, but we often forget to talk about what type of psychological things can we do. And it doesn't have to be overly elaborate either. A lot of what we try to do in the office is combine these things with our natural approach to try to help people to distract and give them this advice. Obviously, when we identify people who it's a little bit more serious and needs more of a professional approach, then we'll make that right recommendation to the right professional, because we're not psychologists, but definitely we are trained in order to identify when it's at a point that does need the referral.
And I would imagine that the longer the pain goes on, the more that factor becomes light, right?
Yeah, 100%.
The longer you carry on the pain, the worse it gets.
Yeah,
right?
For sure. Chronic issues, it's always, I've told anybody that I see when they come in and it's like, I've had this for 10 years. I always say, well, it's going to be easier to treat if this was only 10 days old. So 10 years, we're working against 10 years of that potential phantom, quote unquote, pain that does exist. And phantom limb pain is a very real thing. And the good news is there are ways to get around it for sure, but the person has to want to make that change, and it's not easy. It's definitely not easy, and the people need to want to get better.
Got lots of open lines. You want to talk to either doctor here? We'd love to have you on the Dr. Payne Show. 416-870-6400 *640 on cell. It is the Dr. Payne Show right till 1 o'clock this afternoon. Talk Radio, AM 640. 11:43 on your Saturday here till 1 o'clock. The Dr. Payne Show. Dr. David Greif is here, our guest, along with you, Dr. Lou, and we get to the phone calls as always. 416-870-6400 *640 on cell. Leo, how are you?
Yeah, not too good.
What happened to you, pal?
I got run over by a truck years ago. It broke everything. I initially was in the hospital for 4 months. Took me another year to walk again. But the membrane in between where my pelvic bone meets my lower sacrum area, supposedly I was told by specialists, got severe arthritis all through there.
Okay.
And heat helps. I have heat pads, plus I go for aquatherapy, Whirlpool. The jets seem to help loosen everything up, and I get a massage usually about once a month to help that. Plus I'm on pain medication.
Mm-hmm. And Leo, I'm assuming in a lot of pain day to day?
Constantly.
Yeah. So in things like this that have happened so long ago, and this kind of ties back to what we were touching on, that a lot of the times when you have injuries such as this, which is a very unfortunate injury, obviously, and obviously easy to understand why you're in so much pain, the best way sometimes to intervene is through the mind, because it'll be very hard to make a lot of change from the physical aspect of things. And we were just, Dr. Greif and I, before we went on break, we're talking about how when you actually change the way you think, you change chemicals in your brain. And do you want to just explain that a little further, Dr. Greif?
Yeah, we know that there are pain-relieving chemicals that are produced in the brain, known as endorphins. There are other stronger-acting, longer-acting chemicals also. And you might still, even at this point, have an experience of that. The times where you feel maybe closer to normal, or a little bit better, or a little relief, or you're not aware of the pain so much. Your brain is trying to produce these chemicals to give you relief. We know that long-term use of analgesics, narcotics, opioids can affect the way that your brain produces those endogenous chemicals. So,
in a negative way.
In a negative way, unfortunately, it's a double-edged sword, because not taking pain relievers, you feel pain, but taking pain relievers, you limit your body's own ability to produce those pain relievers.
You kind of make your body lazy because you're taking, is that what it is?
A good analogy would be when athletes take steroids. What happens is they reduce their body's need. So the feedback mechanism tells the testicles they don't need to produce testosterone anymore.
Right.
And athletes often will end up with shriveled testicles if they've taken anabolic steroids.
Yeah.
Yes, believe me, I've tried the whole gamut the past 10 years, acupuncture, everything.
Yeah. Sure.
And I've even done meditation and yoga and everything. Like I said, like days like today, like with all the dampness and everything, sometimes I can't even get out of bed. I crawl out just to get into a hot bath with Epsom salts. That's how bad it is.
Yeah. Yeah, and for sure. No, the thing about all this stuff is, one of the things that, and probably not your fault, but a lot of these things should try to be done together. A lot of times you'll hear people say, I tried this, then I tried that, then I tried that. A lot of these types of interventions, especially for an injury such as yours, Leo, kind of need to be done together. And the other reality that I think sometimes that's, it's easy when people are diagnosed with, say, something like diabetes, they accept that they have diabetes for the rest of their life.
Right.
Pain is very similar to any other health concern. You likely, when you're diagnosed with some type of pain, you likely will have a bit of that pain for the rest of your life. So it's more about management. So unfortunately, you're going to have good days and you're going to have bad days, similar to people who are diabetic that will have better days than other days. It's just about how do you manage it? How do you go forward managing it to keep it under control, and understanding that, coming to grips with that, to understand this is something that I have, that I'm going to take care of and do things day to day. You can't just, especially on the cognitive side of things, you can't just meditate for a day or 2 days and expect that that's going to work. That process has to be continuous. It has to be a lifestyle change that happens in order for those types of things to really be effective long term, to help, again, not cure the pain, but at the very least help manage it, to keep it at a level where you can function.
Gina, sorry. I was going to say, we'll just take, before I get to you, Dr. Greif. Gina, we'll just got about a minute here. I know you've been waiting for a while. You want to tell us what's going on?
Yes. Good morning. I have a frozen shoulder, and I'm looking into a procedure called Trigenics. I wanted to understand if you have a take on that.
You guys both nodding your heads going, yeah.
Well, Dr. Greif practices Trigenics, so I think he can answer that very well.
Yeah. So there's been some recent advances. I'll put that in quotes just in case, because I can't vouch for it entirely. But some recent developments that suggest that there are faster ways to resolve frozen shoulder. Normally, the cycle for frozen shoulder is a freezing, a frozen, and a thawing phase, which takes about 18 months. Mm-hmm. Trigenics may be able to get you through that a lot faster.
Yeah.
If you're being asked to lay out a large sum of money, I would ask for a guarantee.
Yeah.
Okay. Thank you very much.
Well, if you're interested, Gina, come by the clinic. Again, Dr. Greif practices that, and I think we all practice the same way, where we have a lot of different tools, and we'll combine those different tools. So we never just tell people, here's the only thing you're going to get, but it's part of a bigger plan.
Just on the side, Gina, 1-855-55-Dr. Lou. That's DRLOU, or info@paincarecanada.com. I want to send Dr. Lou an email. We'll continue here and finish off hour one of the Dr. Payne Show. We're going to, as you know, right till 1 o'clock, right here. Talk Radio, AM 640. 11:53, hour one of the Dr. Payne Show. We'll get to a couple phone calls, and, of course, the second hour is coming up as well. Ross, good afternoon, or good morning. Anyway, how are you?
Not bad. Yourself?
Good. What's going on with you?
I was diagnosed with multiple epiphyseal dysplasia in my late teen years. I've had 2 hip replacements, one when I was 21, and my second one was done beginning of last year. It's a condition that affects most of my joints, Like the weather really affects it, makes it more painful. And also when I'm active as well, I get incredibly stiff and extremely painful. And I've been on pain medication for about half my life, ever since I was about 20 years old. And over time, I've built up a tolerance. So just in the past couple of years, my family doctor increased my amount. And like that just barely gets me by. You know what I mean? Like I still experience pain with the pain medication, and without it, it's like my life is living hell, you know? And I've seen pain management doctors at St. Michael's. Like I've tried every possible option I have. They put me on other analgesics, like anti-inflammatories and other antipsychotic medication, but I just got all the side effects of that, and like I'm looking for a solution. If you have any recommendations.
It's not easy for sure what you have going on, and you've kind of been through a lot of different types of therapies. Again, my big thing that I'm always kind of an advocate for is when you've done a lot of interventions on the chemical and physical side, the other option is intervening on the cognitive side. But I'll turn it over, Dr. Greif. Do you have anything that you can think of?
Well, the only chemical approach that I would question about is: has anyone suggested trying the cannabidiol, the CBD from the?
Well, that's the thing. At the pain clinic, they just prescribe me with cannabis. And so I have been taking that. I don't find the CBD really, I get much relief from it. It's more like THC, kind of get my mind off it. You know what I mean?
Sure.
Right. Yeah.
So other than that, like my family doctor started me on, like I looked at analgesics. I've done my research, and I pretty much started at the top with Percocet, right?
Right. Okay.
The opioid family. So,
how old are you, Ross?
I'm 37 years old.
Okay.
So I don't see me going back to the lower level medications for pain relief, right? Like I've built up such a tolerance, and I'm so like my body's pretty much dependent on this medication.
Yeah.
To function, right?
I would say, Ross, that it might be the road back is to start to move back away. And see if your own endogenous system will pick up a little bit.
Yeah.
Would Ross would he be a candidate for CBT of any degree, or is he?
Well, I think there's always a level of therapy for the mind that can play a role. But I think what Dr. Greif is touching on is that the same way you can be weaned onto things, you can also wean yourself off of things. And start to remove that. So that may not be a bad approach like Dr. Greif is suggesting, where you try to move backwards slowly and try to involve more of your body's natural ability.
Come at it from a different angle.
Do these things, for sure.
We'll try to get to Vince. Hey, Vince, before we wrap for this hour, I got about a minute. What's going on with you?
Hi there. Good afternoon or good morning. It's just something that's been kind of annoying me for quite a few years now, and doctors haven't figured it out what it is. It's my left toe feels like it's like a slight pain, and the slight feels like it's sleepy, and the left foot below the ankle feels a bit numb at times, especially when I sit down or for a long period of time. And even when I lay down, if I lay down on my back, it feels odd, but I have to turn around on my stomach when I'm sleeping. And then when I'm sleeping, and then I wake up, I don't feel any discomfort. But when after I lay there for a little bit, then it starts to bother me a bit. So it's been ongoing for 3 years. I've had ultrasound done on it and other tests, but they haven't been able to figure it out why.
So, Vince, have they only been looking at the foot in all of these tests that you've had done?
The leg and the foot.
Yeah. So it's a numbness? You get kind of a numbness feeling sometimes?
Yeah, numbness, tingling sometimes.
So those, again, are neurological types of symptoms that would suggest some type of a nerve issue. And similar to when we were talking to the person about sciatica, irritation of a nerve, we have to try to figure out where the nerve could be irritated. Your nerve could be irritated as high as your low back or potentially even higher in the spinal cord somewhere, causing the only symptom that you feel being numbness in the foot. So oftentimes what might be done wrong is that they only are looking at the immediate area of complaint and not looking further, right? There could be other areas with a problem going on that may be the source of the actual problem. Do you agree with that, Dr. Greif?
Yeah, that's true.
Yeah. So
when the doctor touches when I touched my toe at that spot where it feels most numb, I could feel pain. But when I touch my other toe, it feels normal.
Right.
So it's kind of odd.
Yeah, well, one of the things with any type of neurological issue is you can get some hypersensitivity stuff going on. And so, again, that's something for us to ever be sure on anything. Give us a call. We can set up that assessment, free consultations to anybody that's listening. And from there, we can make the proper recommendations. But that is something to always consider, that it could be coming from higher up than just the foot or the leg.
Vince, for you and everyone else, 1-855-55-Dr. Lou, DRLOU, and info@paincarecanada.com. Take a short break. Back into hour 2, the Dr. Payne Show, right across the top of the hour on Talk Radio AM 640. Getting nice and sunny out there. Second hour of the Dr. Payne Show here on your Saturday. No April Fools today. This is all real help in real time. And we're where do you want to go now, Dr. Lou?
Yeah, so we were talking about, and it would be interesting for anybody listening if they have these things. But we were talking about how sometimes certain things that help one person are just meant to help that one person and can't necessarily help everybody. And we've heard weird stories about people that have done something and it's helped their pain, but it doesn't necessarily help someone else. And Dr. Greif was talking about this. So do you want to share with us?
Yeah, the science is a very important process, and we certainly have advanced tremendously as a species because of science. But science is based on the idea that things are reproducible, that that's unbiased. It doesn't matter who does an experiment. It doesn't matter who's involved, that it will work. But the fact is that in health, not everything falls into that rubric. And that's why we know that we do double-blind studies with placebo controls. What that means is one group will get an actual treatment and another group will get a fake treatment, something that has no therapeutic value. And reliably, people who get the fake treatment get better to a certain extent, or a certain proportion get better, almost always. Now we know some people respond more to placebos and some people respond less. What I'm getting around to is there is a neuroscientist named V.S. Ramachandran who tells a good story about reproducibility, and he says, if I was to tell you that a dog speaks English, you would be skeptical, but say, okay, show me that dog. And if I brought you the dog and you had a conversation in English with that dog, would it be logical to say, but that's just one dog?
Yeah,
I need to see 100 dogs that speak English before I believe you.
Yeah, follow the scientific method.
Occasionally, a unique effect can happen in healthcare for a patient, and whether that is from a strange treatment or a meditative technique or prayer, or it doesn't matter. It's possible that you can activate a healing process in your body, because that's really where healing comes from. It doesn't happen from a blade or a pill. It's because something happens in your body to produce a healing effect.
That's right. Yes.
So whatever will turn that on is valid.
Yeah. So just because it worked for one person doesn't mean you can package it, label it, and send it out to everybody and be a blanket cure.
Yeah,
right?
and our job is really kind of to look at research for its general opinions. But I've had people who have come in and said, here's what I've been doing and it's been working. And although there may not be evidence to it, it's like, okay, well, if it's working, it touches on the placebo effect. If the belief is there that it's working for you, you're getting better. The end goal anyways is to get better. Does it really matter how you kind of get there? Totally. As long as the professional is not the one trying to sell, I'm a little bit against people that try to sell things that scare people and scare tactics into getting better. But, there's plenty of research out there that I heard a funny story as well where there's plenty of research out there that just makes perfect sense. And you wonder, why did someone even spend the money to do this research? And I remember once a colleague of mine brought me a research article making fun of this, where it was an article about parachutes save lives out of airplanes that are going down. And it's like, of course they do, right? So there doesn't really need to be the research around that to kind of understand some of these things. But the placebo effect is huge, and it needs to be used by everybody for sure.
416-870-6400 star 640 on your cell. Got some open lines. Want to give us a call? We'd love to talk to you over the next hour. James, good afternoon.
Hi, good afternoon. I guess I've been diagnosed recently with a condition with my foot and heel pain. I believe it's plantar fasciitis. And I've been going to chiropodist, whereby I've had custom-made orthotics. I've had some acupuncture. I've also had what's that machine called with the shocks? It just sort of slipped my mind. But I sort of a TENS machine. Sorry, that's what I had as well. But the pain doesn't seem to go away, especially in the morning, where I'm literally limping out of my bed. Mm-hmm. It gets better throughout the day. I haven't really done anything to get it in the first place, like any sports or anything that would aggravate it. And I just wanted to know, what am I looking at as far as long-term prognosis?
Right. I'll let Dr. Greif take this, because not only has he treated a lot of foot issues, he's had a lot himself.
Yeah, that's true. For the most part, in my experience, plantar fasciitis can be self-limiting, and that is that it goes on and on and on, and you think it's never going away, and then you forget about it, and it's gone. So how long have you had it?
It's been about a month.
Okay.
And I haven't changed any footwear or anything like that. So there's nothing, like I usually try to retrace my steps, and there's just nothing that comes to mind that any injury, that something that may have aggravated it.
Yeah, no, this is something that's very common. Stretching your calf, doing some rolling on a ball or a bottle for your foot to stretch out the ligament can be very helpful. Icing your foot, all those things, they certainly can be helpful. Mm-hmm. It will go away eventually. My own experience recently, I had plantar fasciitis, and on the squash court a couple weeks ago, it ruptured. Oh, I don't recommend it, but the pain went away immediately. So that's another way around it.
We'll take a short break, guys. More of your phone calls just ahead. Got open lines, 416-870-6400. Star 640 on cell as well. The Dr. Payne Show. It's Talk Radio, AM 640. It is 12:14, hour 2 here. The Dr. Payne Show. Reminder anytime. info@paincarecanada.com is the email address, and 1-855-55-Dr. Lou, DRLOU. That's to get a hold of you and your team at the clinic. Let's talk about acupuncture.
Yeah, well, we have a bit of an expert here, so I think we should take advantage of that. Dr. Greif, can you walk us through a little bit about acupuncture, kind of a brief history, because obviously the history is very lengthy, but and then some of its indications that it's used for.
Okay, so first of all, I just want to clear the record here. I'm a chiropractor. In our scope of practice, acupuncture is included. Yep. So I am not a acupuncturist.
That's right. Yeah.
Because that's a regulated term under the College of Traditional Chinese Medicine. But I have been practicing for 25 years.
Yep.
So I have some experience with acupuncture. It dates back very early on. The Yellow Emperor of China wrote about it in a dialogue on internal medicine. It may be 2,500 years old, that wow. document. It may be older. Wow. It's hard to place the time exactly. But it's placed in the whole context of Chinese medicine, which is a system that understands that nothing is disconnected. That the mind and body are the same thing.
Right.
That the environment and the body interact intimately. That sounds and flavors and colors all interact with us very intimately. So acupuncture, as it's often practiced in the West, is a modality. It's something that's done like ultrasound, like TENS, like stretching,
sure.
Just as a standalone sort of approach to treatment. But
another
that's not,
tool.
Yeah, a tool. But that's not really where it came from, and that's not how it is really approached from a traditional standpoint. However, even in that very limited way that it's approached in the West, it has dramatic effects for pain relief. It may... I had a case of a blacksmith who had overuse injury of his wrist, and it was so stiff and so painful. When he moved, you could hear a squeaking sound in his forearm as he moved his wrist. And so I used a technique in acupuncture where you could say it was a fenestration or a windowing or creating holes in the sheath of the tendon.
Okay.
And it's a more traditional form of technique. It's not something that's used a lot in Western acupuncture, but immediately the effects were immediate. It relieved all of that squeaking sound as well as all the pain and all the limitation of movement. It happened quite instantly.
Is that a similar technique that we were talking about that you did to me for my shin splint that I had that one day?
Yeah, same
and
idea.
it was sure enough, immediately it was gone.
Yeah. The saying that I like in acupuncture is, if you stick a pole in the ground, you see the shadow right away.
Right.
You know you've had a good response to acupuncture if you feel results immediately.
Yeah. I want to go back to the fact that you ran into a blacksmith in 2017. What are you in a Pioneer Village for some reason? Hang around Mennonites there, Dr. Grave?
Actually,
like a blacksmith. It's like War Ingalls.
Thoroughbred racehorses.
Oh, okay. Okay, there you go. I'm like, that's the part that caught me, right?
Yeah, right.
So there's more to it than just what we'd understand the West of sticking needles into parts of your body, right? Yeah. There's more to it because that's what everyone thinks of acupuncture, little skinny needles sticking all over you, right?
Yeah, that I mean, it does work.
Mm-hmm.
Even if it's done kind of naively and without, it can be effective, but it's a bit lucky if you don't know what you're doing.
Yeah, for sure.
Someone with traditionally, you would be an apprentice for maybe 15 or 20 years to a master.
Jeez.
You wouldn't do this out of the box. It's something that is a very long tradition of learning and so on.
Yeah.
We've packaged it, into a neat Western model to be able to use it. And, it's endorsed by the World Health Organization as an effective treatment with low risk. The incidence of infection is extremely low, although, of course, if you're invading into the skin, it's something that has to be taken into consideration. There has been a case here in Ontario that was quite prominently portrayed quite a few years back. But if you use sterile needles and you use clean technique, there's extremely low incidence of any risk.
And most people practicing right now, it's all clean needles. They're all self-packaged. Once you're done with them, they're being disposed. You're not reusing those. And similar to Dr. Greif, I actually practice acupuncture as well. I did more of what was called the medical contemporary acupuncture, which is that nice Western approach. And just like Dr. Greif touched on, that even not really, knowing its full intent, a lot of research has suggested that putting a needle into the body does have a neurological effect. It has a hormone effect, and it's those things that help the healing process just from a very simple perspective and not even going even further. Now, we're not encouraging people to stick needles in themselves, but definitely acupuncture is something that we use a lot at the clinic, and we found to have great benefit with a lot of different problems.
Is it many treatments you find, or is it just a couple?
It depends. I think that's like anything, right? That blacksmith, he felt better right away. I felt better when I had my shin splint. But it depends on the problem, right? Some problems can get better quickly, and some problems take a little bit longer, for sure.
416-870-6400, star 640 on cell is the number. Get to your phone calls after a short break. We got some open lines. You have some questions, discussions. We'd love to talk to you here on the Dr. Payne Show. Talk Radio, AM 640. 1223, we'll bounce over the call and continue our discussion on acupuncture with Dr. Greif here. Got Sammy. Hey, Sammy, how are you?
Hey, good morning. Thank you for taking my call,
Sure.
Doctor. Listen, I'm 73 years old. I've been having this headache lately, big headache, in my both left and right ears, very, very itchy. And sometimes my left and my right arm, just a half of my arm, they go numb on me. Anyway, last Saturday I went to Mount Sinai because I don't have a family doctor. So I was examined by a doctor there. They did an X-ray on my head. So thank God when the doctor come back, he says there's nothing wrong with it. Everything's normal.
Mm-hmm.
Should I be concerned about something?
Well, I think they probably did a CT scan, and they were probably looking for something like a stroke in progress or something neurodegenerative in nature that can be picked up on that type of imaging. Having said that, you still have a problem. You still have headaches that are causing these types of symptoms, and a lot of times these things can also be consistent with things like migraines. And so it is probably something that you should get checked further, just because they can be pretty debilitating, and have someone who can look at that and try to figure out why this would be going on. Do you have anything, Dr. Greif?
You said you had itching in your ears. Do you also feel any pain around the jaw? Or do you have any problem with chewing?
Not at all, doctor. No, just like I said, my arms go numb on me sometimes.
Mm-hmm. What were you alluding to with the pain in the jaw?
Oh, well, the joints of the jaw, the temporomandibular joints, can also sometimes cause headaches. And when he said itching in the ears, the jaw actually, the joint sits right in front of the ear, and sometimes it's easy to miss that.
Yeah, and so a lot of these types of headaches do, even in migraine type of headaches, there's a big musculoskeletal component that often exists with the dynamic of the neck, the jaw, the upper back, and all the tension that's potentially created. So, it's definitely something that we can take a look at and try to understand what's going on, because at the end of the day, I think the right thing was done. It's, something that's life-threatening has kind of been ruled out to some extent, but that doesn't mean that it's not going to have an effect on quality of life, which is a lot of the issue with pain, and maybe why sometimes it's not taken as seriously is because it's not often a question of the quantity of life, but the quality of life with pain management.
We're talking about acupuncture before the phone call, and it's like, Dr. Greif, every time, the few times I've had acupuncture, if it was, say, a pain in my lower back, that's where the needles went in. But then you see the chart on the wall, and there's a root. They might put needles in your foot to affect something in your shoulder. What's the difference in treatments?
That's right. So there are many different ways to approach acupuncture, right. And some of the traditional approaches look at the channels. And so, like you said, if for a headache, sometimes there's a point in the foot that is very good for that. Mm-hmm. And it relates to the liver channel, which ascends from the foot up to the head. And it can, according to that theory, can release that energy and help spread it around more freely.
Is it just as effective, Dr. Lou, to attack the actual area? Because that's where I've had it.
Well, I think the most effective is probably to, when we looked at it, we would often say, like, let's say we were dealing with a knee issue. And the way I would learned it was you would treat the local area with needles. You would also treat the segmental area, so meaning what corresponding nerve roots would affect that area of the leg as well, as long as treating global points that were found to be such that Dr. Greif's alluding to, that are beneficial. There's some points that, whether it's in the hand or the foot, which it seems to be more often in the peripheries, like ears, hands, feet, where there's these global points that seem to be really good for general pain. So when I approach it as well from that more medical standpoint, I try to treat locally, segmentally, and also globally. So I think that is probably a good way to go about it for sure.
Are those needles always going into muscle tissue?
Yeah, essentially. The muscle covers your body pretty well, so it's pretty hard to miss.
To miss it, yeah.
However, it's not always the target.
Right, that's what I mean.
Yeah.
Okay.
You might go into a joint. Yeah. You might go...
a nerve.
Yeah. There are points, actually, that go underneath the eyes, like in the space under the eyes.
Yep. David, we'll get to you quick here. Got about a minute. What's your concern?
Thank you. Yesterday I was at work and I just got really, really dizzy that I couldn't hardly walk. An ambulance came and checked me over. They said they couldn't find anything wrong. So I was just wondering what the doctor's opinion is on that.
Can you give me a little bit more history, David? Like how old are you? What's been going on recently?
Well, I'm 48. It's never happened to me before.
Okay.
It was the first time. That's why it was so scary.
Mm-hmm.
I couldn't even drive my car. I had to get somebody to come here and drive the car for me.
What time of day was it?
Around 2 o'clock.
Okay. Had you eaten breakfast and lunch?
Well, yes, I had some breakfast and a little bit of lunch.
Mm-hmm. Was it anything out of the ordinary from the diet perspective, or that's kind of the way you always eat?
Well, I did have a pastry from a bakery close by here. I was thinking that maybe because it was a coconut-based pastry.
Mm-hmm. And so it was just dizziness that you were feeling? Were there any other symptoms that you had?
A lot of dizziness and really, really sleepy.
Really sleepy. And so what did the ambulance, did they take you to the hospital, or they were just on site and check?
On site, they just checked me out. They put those little connectors on for my heart and all that stuff.
Right.
Yeah.
And we took some blood for these sugars.
I mean, my definite recommendation would be to follow up further and get some more testing. Dizziness could be the result of a lot of different things. And so you want to make sure that there's not something else going on. So I definitely think that it's worthwhile to continually follow up and try to figure out what could have potentially been causing that.
Take a short break, 416-870-6400, star 640 on your cell. You'll want to give us a call here till 1 o'clock in the Dr. Payne Show. Talk Radio, AM 640. 1232 in the Dr. Payne Show till 1 o'clock. You got something you want to talk about with Dr. Greif, yeah?
Yeah, so Dr. Greif sits on the board for something called World Spine Care, and we're very familiar with things like heart and stroke and Ride to Conquer Cancer, things like that. But World Spine Care is an initiative towards spine-related problems, and I'll let Dr. Greif talk about it a little bit more because I do think it is very important. Most people, back pain is something that affects 80% of the population, so significantly more than some of the other things that we often talk about.
Yeah, when we look at global burden of disease statistics, it's actually spine-related disorders that disable more people or a greater cost than any other factor.
Wow.
When you combine low back and neck pain together, you have the greatest amount of global disability.
Wow.
So, and it's not sexy. It's not something that gets a lot of attention, but a real visionary of a man, Dr. Scott Haldeman, who had been directing the Bone and Joint Decade Task Force for the World Health Organization, created a legacy project called World Spine Care, identifying areas in the world that are basically underserviced or unserved for spine-related disorders, and has created a sustainable model of full primary, secondary, tertiary care for spine-related disorders. So everything from yoga classes through rehabilitation and surgery is available in places where there was previously no experience with treating these disorders. And people who otherwise depend on their bodies for their livelihood, people who don't have desk jobs necessarily, but work or survive because they're able to move and travel. So back disorders can be a major impairment for these people. Clinics currently exist in Africa, in India, and in Dominican Republic. And the World Spine Care Canada supports the Dominican Republic project.
Okay.
We know that the Toronto Blue Jays have had a great association with the Dominican Republic, and the Canadian Memorial Chiropractic College has also had a very good relationship with the Dominican Republic and a doctor there.
Yep.
And out of that, a permanent clinic has been established to not only provide care, but to research, understand the effects of back pain on that population.
Okay.
And because the target is for places where there has not been previous care, to see if we can create a model of care that exceeds what we expect in maybe developed parts of the world where we already have our habits and our routines. Create the best model of care possible.
Right.
And that's what World Spine Care is doing. Another part of the project is something called the Global Spine Care Initiative, which is the research branch of World Spine Care, and it's looking at understanding the best approach. If someone was to come in with back pain, it could be anything. You can't assume what it is. And so what is the right approach to take for a patient who comes in, and how can you most effectively and most efficiently provide that care? I'm very proud and happy that this does exist.
Right.
And as I had talked about earlier, that volunteering can be a very healing effect. World Spine Care does expect all of its workforce to come from volunteers. And so we have chiropractors, physiotherapists, surgeons who are volunteering their time to this. But it's beyond that as well. There's a scholarship branch to this as well. And local students from these areas, if they qualify, are given a full scholarship to study.
Awesome.
There's been advanced surgical studies done for a doctor from Botswana who is now the first advanced spine surgeon in that area. There are 2 or 3 chiropractic students now who are coming from Africa, who are in Toronto, in the States, studying on full scholarships to be able to go back and take over these clinics. And the other part, the sustainable part of this, is that the governments where these clinics are set up will be responsible for continuing to run these clinics.
Wow.
In the meantime, for the first part of that pilot project, it comes from donations.
Mm-hmm.
If anyone wants to know more about this, you can look at worldspinecare.org.
Okay.
And just take a look and see the marvelous work that's being done in this area.
Yeah, I think that's a great initiative. And again, I agree totally with Dr. Greif that, again, because spine things don't often affect the quantity of life. When we talk about heart and stroke and cancer, we often will put a lot of money and effort towards things that affect.
I hear about them all the time.
Yeah, and because there's an effect on the quantity of people's lives, and I'm not saying that we shouldn't, but things like spine care, like you've suggested, Dr. Greif, the amount of costs that it has on the population is so vast. I think even in Canada and the U.S., from a corporate standpoint, it's the second most common cause for lost time of work, only behind the common cold. Wow. Right? So back-related issues and neck-related issues. It's something that's so prevalent, right? I think it's 80% of the population at some point will experience back pain or some type of back pain. So it affects almost all of us. And I think there needs to be a good effort towards spine care, spine management, because it's our backbone, right? It's literally the pun, but it's our backbone. It's what keeps us together. And so, I think it's a great initiative. And again, the email address is what, Dr. Greif?
The website is
worldspinecare.org. Yeah, awesome.
Donate. It's something that doesn't get a lot of play, right?
Anything would help for sure. Anyone that's listening, if there's any interest, we'd appreciate it for sure.
We'll take a quick break. Want to talk about necks and backs? A nice lead into it right there. We got open phone lines. You want to give us a call? 416-870-6400 star 640 on sale till 1 o'clock. Dr. Payne Show. Talk Radio, AM 640. 1242, got open phone lines. Lots of time for you to call in till 1 o'clock this afternoon. And we were just talking about necks and spines and the statistics you gave out as far as the people that have suffered from some sort of neck or spine problem is pretty huge.
Yeah, for
right?
sure. Yeah, and they're the two most areas of complaint in the spine. Mainly the thoracic spine has the rib cage, which provides an inherent amount of stability, which makes it less likely to be hurt than the low back and the neck. And then I believe the low back is more common than the neck just because of gravity and weight on top of it. But definitely two things that affect so many people, especially with the type of lives that we live here in Western society where there's a lot of sitting, a lot of desk jobs, or even if it's a physical job, these are all things that can have an effect on the neck and the low back. And then, when people come see us with neck and low back complaints, it's like Dr. Greif said, you don't know what it is. All you know at that point is it's pain. What's causing the pain? And so we're looking at pain on a spectrum. And when we're looking at a low back, we're looking at a spectrum where we're thinking, okay, it could be something as benign as just a simple muscle moving towards more serious things like a disc herniation, or you could have even more serious things like cancer infections on the other end of the spectrum, which again, we tend to in our office treat the things that are more towards the middle to the end, the benign area of the spectrum that you can treat from a musculoskeletal perspective. But we're well equipped to look at somebody and determine where they sit on that spectrum and point them in the right direction, get them to the right channels in order to figure out exactly what's going on so that you can come to a conclusion and solve the problem. But it's not uncommon to have serious things going on, and some of the first symptoms that people will feel is back pain. I have actually a close friend of the family right now who unfortunately is dying from prostate cancer, but his first symptoms were back pain.
Wow.
And that's what he thought it was. And again, we were able to kind of identify it doesn't really seem like it's musculoskeletal in nature. And so you start that person down other avenues to figure out what's going on. And if you catch things early enough, that I think that's the key. But pain should not be something that's ignored, nor do I think that people should just have low back and neck pain and think that it just resolves on its own, because oftentimes it just resolves the wrong way. Do you agree with that, Dr. Greif?
Yes and no. Yes and no. There is a self-limiting nature to episodes of back pain.
Yeah.
But if it becomes a bad habit of doing things that are not helpful,
Mm-hmm.
then that has to be some retraining involved.
Yeah.
The other thing about the self-limiting nature of back pain, it also has a high rate of recurrence.
Yeah.
That if you've had back pain, there's a good chance you'll experience back pain again at some point.
Oh, yeah.
Yeah.
So it's good to know what to do about it, and professionals can help you to understand the best way to approach it, to address it.
It's funny. I used to work at the Sun. And it was a job where you're wearing work boots, you're on concrete all day. A lot of the guys in there ended up having either neck or lower back pain. And I remember a friend of mine years ago, it'll always stick with me. He said he was convinced that humans as a species, we stood up too damn fast. We should still be on four legs because everybody's got back pain, lower back pain.
And even some dogs still have
back pain. And even some dogs still have back pain, too. Got Rachel on the line. Hi, Rachel. How are you? Hey, Rach.
Okay, so I got an epidural in June, and they messed up on it. So my right thigh, I cannot feel it at all. And just recently, the past month, both my left and my right side of my back, I've been getting these piercing, pin needles in it. I went to a neurologist, too, and they couldn't figure out what was wrong.
Okay, Rachel, it sounds like there was a little bit of nerve damage done. And, there's a good chance. This was in June. Okay.
Yeah.
So we're getting close to a year. And, there's a very, very good chance that it will gradually start to resolve itself. I would say that, in my experience, sometimes some acupuncture or other forms of electrotherapy can help to stimulate the sensation to come back. Have you tried anything like that?
When I went to the neurologist, they put pins type thing inside of my nerves.
Yes.
But I couldn't do that. I did 1 or 2 sessions, and it hurt me. It was very painful.
Were they doing it to measure the nerve conduction?
They did, yeah, they did that, and they figured that I didn't have any feeling in my upper thigh.
Mm-hmm. Right. So did they find that there was also a change in the nerve conduction through the testing? Did they recognize nerve damage there?
Yes, they did recognize there was damage in
right.
My upper thigh, but my back, they couldn't figure out anything there.
Right. Okay. I would say that, it would probably be a good idea to have some therapy applied, whether it's massage, acupuncture, chiropractic, something that...
more of a physical type of...
Yeah, movement, something to stimulate your body's recovery.
Yeah, for sure.
Okay. Would you think that I could get some kind of feeling back in my upper thigh, or do you think that could be permanent damage?
There's a good possibility you'll get sensation back. I can't guarantee it, but there's a good chance that you will.
Yeah, I agree with that.
Do you want to call the number just in case?
Sorry?
Would you see her?
Yeah, she's more than welcome to come in. Yeah, 1-855-55 Dr. Lou. We can take a look at it through the provider network that I have across the GTA. If our clinic's not convenient, we can also get her somewhere else. But yeah, for sure. A lot of these things do require some people often will. This is not uncommon to hear this, where people have something and they stop kind of dead in their tracks, where they're like, okay, what else can I do? There's always options. And with spine-related complaints, again, I'm biased because I'm a chiropractor myself, but that's our forte. That's what we're really good at, is spine-related complaints.
Getting down the last few minutes here, so you still got some time to call through if you'd like to hear from you. 416-870-6400 *640 on Cell. Dr. Payne Show, Talk Radio, AM 640. 12:52, a few more minutes to go here till just before 1 o'clock. This 2-hour version and 2-hour edition of the Dr. Payne Show. Loving it. Got Aaron on the line. Hello, Aaron.
Hi.
How are you? What's your concern?
So I have a degenerative jaw disease where the bones are disintegrating, basically. It's a very long story. First noticed it when I was 13. It kept getting worse. When I was a young adult, in my early 20s, it started to get worse. The pain started to impact my day. I went and saw a specialist, and I'm doing air quotes, After 3 years with him, he put splints in my mouth that I wore 24/7, and he stretched out my lower jaw so far that my discs actually snapped. And so now I have this disorder that just keeps getting worse and worse. I've had 3 arthroscopic surgeries. I'm seeing a surgeon at Mount Sinai. I go to the Wasser Pain Clinic, although it hasn't been very effective. My last surgery was an emergency in November when I went to the dentist and my jaw dislocated. So he had to bring me in the next week to get it fixed up. After I saw him, he told me that the damage in my jaw was much worse than he had expected, and that he felt the only thing that could help was a total joint replacement surgery, which is very risky and is only a 50-50 success rate from the information that I can gather. He's a very conservative doctor and has always told me from the very beginning that he would only do that if it was an absolute last resort.
Right.
So now I'm really scared. And although I completely trust my surgeon, I don't know where to go for a second opinion. It rules my life. The pain, the jaw is the most used joint in your body, and the pain is incredible. I'm on a lot of high doses of medications. Medications affect me in a very odd way. It takes very high doses to get any relief. So I'm at a fork in the road, and I don't know where to go to get any help. In Peterborough, we don't even have a pain clinic.
Okay.
Yeah. Once you've had all these interventions, it does become very complicated.
Yes.
And one thing I would just note is you seem to at least be speaking well, that your jaw is,
talking with my teeth shut.
Yeah, okay. So are you eating any solid foods?
No, I'm on a soft food diet as much as I can,
Yeah, okay.
Yeah.
There may be, you're under the care of a surgeon, and that may be your best alternative at this point. Mm-hmm. But there's another side of it, and that is just finding a way to be comfortable with your jaw. And there are some cognitive behavioral techniques and other postural techniques that can be helpful to just let you relax your jaw when it's not in use.
Yeah.
And I don't know if you've had anyone work with you on those sorts of things. Yeah.
Oh, yeah.
Okay.
Why surgery right now feels like it's the only option, because everything else I've tried, even the things that have been effective, are now only effective to a certain point.
Yeah, I would say use whatever is effective that you've learned to this point. Continue to use them. They'll be useful for you for the rest of your life.
Yeah.
But if you can get relief with surgery and the surgeon is willing to try it, and that might be your best option today.
And especially if he is very conservative and has always said that it would be a last resort, if he's getting to the point where he thinks that, it sounds like that's a prudent type of doctor who's, hasn't just jumped to that and said, no, let's do surgery. Unfortunately, sometimes that's the only answer that's left. So, that may be your best option.
Might take the leap, right?
Yep.
Yeah.
For sure.
Yeah, it's a scary thing, just because it's not a very, from what I can find, it's not a very researched topic. And I also seem to be skimming over any proper diagnoses. Like the only thing I have to write on my insurance paperwork, etc., is severe degenerative jaw and bone disease.
Right.
And when I search up, I see things like idiopathic condyle reduction and all these other things, but that's never been applied to me. Mm-hmm. So I don't know if we're missing any treatments because different diagnoses haven't been applied. Mm-hmm. I don't know. Is there anyone that you know of in the area from here to Toronto that specializes in this and could give a second opinion or consult?
I do know of someone, but you know what? I don't have the information with me. If you want to call
Give us a
Dr.
call.
Lou, I will look into it. I will get you the information.
Yeah.
Aaron, I appreciate that call. The number 1-855-55-Dr. Lou. So take us home, man.
For anybody listening that wasn't able to get through, as always, you can call the 1-855-55-Dr. Lou number, free consultation, similar to what we do here. Just a quick conversation. If there's anything I can do to help, I'm happy to try. And that's pretty much it. It's the first leap in any healthcare issue is that you take the initiative, and just making that phone call is often an initiative that shows you want to get better. So go ahead and give me a call. I'll get back to you within 48 hours.
Thanks, Dr. Greif, for coming on the show today. We're back next week here in the Dr. Payne Show. Talk Radio, AM 640.